Well, hello, everybody. Welcome back to the Aesthetic Angle podcast. We are super excited. Kind of our new little project here, doing video along with a podcast here at Monarch. Monarch Plastic Surgery, Skin, and Wellness. And today's topic is going to be in the field of bioregenerative medicine, particularly talking about an injectable product called Sculptra. And I'm honored to be joined today. Well, first of all, I guess I should say I'm Dr. Paul Leahy, one of the surgeons here at Monarch. And I'm joined today by Ashley Williams. She is, I wouldn't say the nicest way, our senior injector. Lots of experience. We'll get to introduce yourself. And also, we are lucky to have Karlie Stroup with us today. Karlie is, I guess what I would say, an expert in everything Kansas City and beyond, and travel and cool food. And I love following you, see what you and your family's up to, and see if I can convince my teenage boys to go do some of the stuff you're doing.
I love it. I love it.
My nurse Maggie's a pretty good sport. We'll go out and check out some of the restaurants you go to and stuff like that.
That's
So
awesome.
thanks for joining us today.
Absolutely.
I'll just speak a little bit real quickly, and then Ashley truly is the good expert in this field. So as a plastic surgeon, and also as our nurse injector, the team we have, people will come to us to basically look younger. What can I do to maybe look a little bit more at the age that I feel like on the inside, And Ashley and I were talking about this a little bit the other day, sort of like, well, we have estheticians who can give you any product you need, any laser, the skin pens, the chemical peels, all those things that you need. We all need those things, actually.
Yeah.
We, as the surgeons, we're kind of approaching at a different angle. So, what surgical procedure might help you get to your goal? And then we have our injector team and also our wellness division too, to really, really feel our best. But when it comes to the injectables and things, there's kind of this new branch of products that are out there that I really want Ashley to help discuss with us today. Because, like, for example, someone might come to me at a party and say, "Hey, I just need Botox right here. How can, and I'm like, well,
all the time.
okay,
Yeah.
you've heard that term, I get that, but there's other things, and Botox is maybe good for this part. But so I'll just quit talking for a second and let Ashley introduce herself, and also Karlie.
So I have been a nurse for almost 20 years at this point. I've been injecting for 10 years, and I've been at Monarch for 7. About 5 of those years, I've been injecting Sculptra. So I feel like I've been doing it long enough now that I have a great understanding of what it can and cannot do. I love Sculptra for myself. I'm actually getting my treatment tonight, which I'm super excited about because I've been feeling like I needed it. And it's hard to find time in my schedule to be able to get my own treatments. So I get really excited about Sculptra. What I love about it is, as you mentioned, it is more regenerative. So I feel like as a society, especially with social media these days, we're seeing a lot. We're seeing a lot of bad work, a lot of good work, and it gets talked about a lot. And so we seem to be moving a little bit away from fillers and more towards things that can be a more natural way of anti-aging. Sculptra is amazing for that. That's exactly the niche that it falls into. What I always prepare people for is you're not going to get that instant gratification that a filler might give you. So a filler usually is hyaluronic acid. It's a gel that we can use to replicate your skin, fat, bone, depending on what product we use and where we place it. Sculptra, on the other hand, is more of like fertilizer for your skin. So
that's a good way to say it.
Yeah,
I like that.
It's not going to give you projection like a filler might. And of course, there's limitations that we have with Sculptra as well. We can't just put it anywhere. We have to be smart about where we're placing it. But it really does help to improve the quality of your skin. It can help with areas that are hollowing. Specifically for me, I just have a long, thin face, and I tend to get very thin in the perimeter. My temples can get hollow underneath my cheekbones, and that can start to look just a little hollow or severe. And so instead of using filler, I prefer to use Sculptra to just kind of thicken the skin in that area and give a gradual improvement to those areas that are starting to show aging and hollowing.
That's a great introduction.
Yeah.
We'll get into some
Yeah.
more details and stuff too. Karlie, do you mind saying a little bit about your
Absolutely.
experience with it?
Yeah. So I'm Karlie, and like Dr. Leahy said, I started Aylen's blog about 12 years ago. I was a patient at Monarch 10 or 11 years, and then started influencing for them as well. And it's been just awesome to get to know everyone in the building, and truly kind of like a second family. You know, you walk in and you see Sina and you see everyone in there. So this is a really cool experience. But my experience with Sculptra, or why I chose to do Sculptra, is last November, I did a high rocks race in Dallas. And so it's like really sort of a competitive race, and
very intense.
Very intense. Lots of training, and lots of running. And so what I noticed is when I was running, I was losing weight, and my face was kind of hollowing out, you know. And I truly thought about this just last week. I think I texted Ashley and said, honestly, everyone from Run Club could benefit from Sculptra, because there's just something about a runner that it happens. It just happens. And so yeah, my experience with that is I came in and talked to Ashley, and I was like, you know, what would you suggest for something that's more of a natural way to add some collagen back in? So I would say, you know, aging plus just working out and fitness intensely meets its match with Sculptra for sure. Yeah.
And we're seeing a lot of weight loss patients right now.
Yeah.
People taking the GLP-1s, they're losing weight quickly, and the skin can't always keep up with that weight loss. And that's another great area for Sculptra to go in, either at the beginning of the weight loss journey to prepare the skin so that it doesn't have so much laxity with that weight loss, or in the middle of your journey if you are, you know, if you lost weight faster than you thought you would and you feel great, but all of a sudden feel like,
Right.
I look so much older. Now I have all this hanging skin that I never had before.
Right.
Well, yeah, that's an unfortunate side effect of weight loss, which is, it's great to have that weight loss. It's healthier for you, but unfortunately, keeping a little bit of that weight in your face can make you look younger.
Right.
So Sculptra can help to just tighten up that laxity of the skin that maybe is showing itself a little bit more with that rapid weight loss.
Mm-hmm. You know, we were talking just before off camera a second ago about some of the history of Sculptra. And as I was sitting listening to you talk about kind of the science about it a little bit too, I was remembering that the product actually is not brand new. I mean,
Correct,
it's been
yeah.
around for longer than people think. I think it just has gone in popularity a little bit up and down. And so I was just going to mention that as I recall, I mean, this is probably coming up on 20 years ago. And I was just finishing my training, and Monarch was actually one of the training sites for Sculptra. One of our former surgeons was actively doing that, and it originally was designed for patients who were on the medication to help when you're HIV positive.
Correct.
The medications would have this weird side effect for reasons that are a little unclear.
Yeah.
That you would have some loss of facial fat volume we call atrophy.
Yeah.
And then this was a great, you know, tool for those folks to use. And then of course it expanded to other people too.
Absolutely. Yeah. And in that demographic with the just facial wasting, Sculptra is great because it is more of a full face treatment. If you were to go in with a patient in that state with filler, there's a good chance, I mean, it would take so much filler. And there's a good chance you'd probably see where that filler was placed because the skin is also so thin. So, I mean, it also shows that even immunocompromised patients can have, you know, under the certain protocols with, you know, clearance from their doctors, that it can be safe for all types of people to have Sculptra. I do love that it's more of a global approach instead of a syringe of filler or a few syringes of filler. I feel like coming back to social media, what was trending for a while was this full facial balancing. I was seeing it everywhere where these injectors are coming in and they're placing, 6, 7, 8 syringes of filler at one setting. And, I just don't know that that's the aesthetic that everybody's looking for now. I think they saw that for a while. Jawlines were just razor sharp. Cheekbones were getting really kind of inflated. So I think there's a little bit of, okay, we saw what that did. Let's take a step back. Let's see what we can do to still get really beautiful natural results with using our own body to do it. And that's what Sculptra can do, is it stimulates the fibroblasts, which are inside all of us, and that's what creates collagen naturally. So we're just kind of adding that fertilizer, like I said, to kind of ramp up the production of collagen. So I love that it is just your own tissue.
Yeah.
And it's an interesting, how I don't exactly know how someone ever thought to do this, but it's sort of like our dissolvable or our absorbable stitch material, our suture material we use in
Yes,
surgery.
correct. Yeah.
And then it's sort of made into imagine pulverizing that stitch material, making it powder, and then we reconstitute it, add sterile water to it.
Yeah.
And then I just gotta say one thing as a compliment to you, Ashley. So, I mean, you've done my injections, and no secret for a long time. And I watch you. Well, if I open my eyes, but I watch you you really carefully move around people's faces, and it's so the shadows and the light that's hitting angles and contours and trying to create that shape that you're after is you just have this really artist eye as you're doing it,
Thank you.
and it's fun to experience. And
is.
Karlie could probably tell you what it's like too.
Yes, it is. We actually just shot like a funny reel
Okay.
doing this, but she was coming in from one angle and then coming in from the other angle. I think she was even like, if she could have hung from the ceiling,
right.
that angle she would have, because it was
Mission
just,
Impossible.
Yes, exactly. And so she was just, and it's true. And it was funny because the way that you look at yourself in the mirror, we are so critical of ourselves, and Ashley is in a very positive manner. So I see things that she may not see, but she sees things that I don't see. But we can collectively agree, which is fabulous. And then I do love how particular she is about that. So it is very important. And it's crazy because, maybe one side will need a syringe and a half.
Correct.
And then the other side may only need like a half a syringe when you go in. And it's kind of hard for people, well, for me, okay, for me to grasp that, because I'm like, why are we only doing, what's going on?
Exactly.
And she sees those things, like your left temple may be hollowing more than your right. And she's very particular about that. So it is appreciated. And to know that she's the expert and that she's done it and seen it is a good feeling too.
Yeah.
So, yeah.
One story I had, I was going to get your take on this too, Karlie, is so last week I saw a patient who had a facial procedure, and she was maybe 3 months away from it, and she had been to a high school reunion. It was kind of one of the things she wanted to accomplish. Which is very tough because you got to fit that into healing, which is why, again, Sculptra maybe, we can talk about that too. But she said something to me that hit me that I hadn't really thought of before, from a patient standpoint. That was, she said, I really like how things look. I'm grateful for the outcome that I've had. But I've noticed that I actually kind of feel better. I mean, like maybe physically feel better, because when I look in the mirror and that one little feature I didn't like, my jowl or my neck, and now I don't see that as much, and I smile more, and that just kind of snowballs at your whole, how the rest of your life goes. Have you noticed that?
I would definitely agree with that. So it's funny. So because it does take a while, I would say, to like kick in, right? It's not like instant gratification, because it's more of a natural, natural building collagen. But what I appreciate is it's probably a week after, I think I texted Ashley and was like, okay, I have a glow or something, because it's like it's similar to maybe a pregnancy glow that you get compliments on before you announce it, maybe possibly something like that. But I was at the gym and somebody was like, your face looks so good. I'm like, well, I haven't been in for a facial, this month yet. I'm like, what did I do? I'm like, oh my gosh, Sculptra.
Yeah.
So I think you just associate Sculptra with a filler, so it's going to fill, but it does so much more. And so I think the glow is really just an added bonus that it gives. Yeah, so there is a little, I don't know, there's that added bonus. And then I would say just, and on the inside, how you feel too. I would definitely say there's just something when you look in the mirror, you're like, okay, that adds to it. And then it's also going to happen. So I think there's some excitement in the morning when you wake up. You're like, okay, what happened? You're like pulling at your skin, like, is there a little bit more, there? So that's cool too. I would just say it's definitely a journey.
Yes.
It's a process. And I appreciate that.
Yeah.
So, yeah.
I feel like I've had multiple people, especially this year, who started their Sculptra journey.
Yeah.
And I do call it a journey because usually there is more than one treatment involved in your initial series. We usually do space them about 6 to 8 weeks apart. But I had 2 separate patients who messaged me on their own, did not know that the other one had messaged me. And it was about 6 to 8 weeks after their first Sculptra treatment. And both of them said, I felt compelled to let you know that I can't visibly see much difference yet from the Sculptra treatment that we did. But I will tell you, I have had so many compliments on my skin recently. And it's not always just my skin. It's like they can't quite put their finger on it. Like, your makeup looks really good today, or your hair looks really good today. It's like they can tell something looks good, but they can't quite put their finger on it. And I know it's the Sculptra because that's the only thing that I've had done. So I love that it's just that under the radar. You're not walking in to a room where it's just like, oh, well, she's obviously had work done. Right. It's just like, wow, you look really good.
That is the best possible comment we can get in anything, aesthetic medicine or surgery.
Yeah.
Yes. And in regards to what you had said with self-confidence, I have had women in my room before where we're just talking about a plan and what we might do, and they tell me that they sit there and they struggle internally with spending money on themselves when they could be using that money for something else, and they use the word vanity. And what my response to that is, vanity is doing something for other people's approval of you. This isn't that. This is self-confidence. And when you feel good about how you look in the mirror, your whole mood changes. The way that you treat other people changes. Like, it is more than just the external part of it. It's just feeling good about yourself.
Right.
That's self-confidence. That's not vanity.
Right.
And that is a great explanation. Yeah. I think the same thing.
Yeah, that's fabulous. And as like a mom and we're moms and dads in the room too. And so we're expected to take care of other people, right? And we're kind of in the sandwich stage of life, some of us, where we're taking care of our kids and maybe also like somewhat taking care of our parents too a little bit. So you're raising your kids and caretaking for your parents. So when you hit that stage and you're not at 100%, and you can't take care of someone else, right? And then you can't help parents find their way as well. It's unfortunate. So in those situations, it's like you do have to have a full cup to take care of others.
That's true.
And so this is just one step. And I think it's hard also, I think, as a mom and a dad, because you're constantly like pouring out and giving. But then when you're empty, it's so hard. Everyone says it's so hard to go on an empty tank. It's so hard to pour from an empty cup. And that's so true. And so this is just one step to feeling better and more like yourself, because you can give more.
Yeah. And this is really just a dip your toe in the water kind of a thing. It's very, very, very low risk.
Right.
Minimal downtime, maybe a little bruising, some tenderness,
Yeah.
But, sometime I'd like to do a little show on just the psychology of all this stuff, plastic surgery and things. I've always been curious about, particularly asking mothers
Yeah.
who may have teenage daughters, for example, who may be considering a more surgical procedure, something more,
Yeah.
elaborate than an injection. How do you, on one side, have a conversation with your daughter or son? Hey, God made you perfect. You're just the way you should be. You don't need to do, you're beautiful the way you are. But then yet you go and you do this thing, you talk about spending money on yourself, and I've always been really listening closely to that response whenever I've asked people. And it's the same thing you just said. It's like, well, and you did too, Karlie, this is not for anybody else. This is just for me. A little bit, just a little confidence boost can go such a long way in, your effectiveness as a person in the world at your job and your relationships and things. So,
Right. Yeah.
So
That's a great point.
experienced that before, but
Yeah.
also something you mentioned is talking about dads too.
Yes, yeah.
So we see a lot more guys coming in. I think yearly we
true,
see more men come for things, and I don't know if Ashley, you could mention this seems like a great thing for guys too who are seeking a little bit more volume.
Yeah, absolutely. And I feel like guys are way more in tune now to anti-aging, more so than they used to be. I feel like a lot of those taboos have kind of gone away. We are seeing the husbands wanting to keep up with their wives. Their wives look fantastic, and so they all of a sudden feel like, well, wait a second, you look great. I want what you're getting. And in that regard, if you bring up filler with a man, they might immediately kind of recoil of like, well, hold up.
Yeah.
They're thinking of, the big lips, the big cheeks, and all of that. And if you talk about it in more of this is more, improving the quality of your skin sort of thing. We're not adding projection. It's not, I personally have never seen anyone be overdone using Sculptra. Again, another benefit of why I love it. So I feel like having that conversation with a man and just talking about, the fertilizing, they understand the yard work sort of reference of, this is a very subtle but impactful change. And it a lot of times flies under the radar. It's not the same as a gel filler where you do see the instant gratification of it. Again, we had kind of touched on how that works. So Sculptra is a powder that we do add the fluid to. So immediately after injection, you can see some volumization of the face wherever we put it. And then after a few days, sometimes a couple weeks, you absorb that fluid and it leaves behind the powder, which does its magic. So after a couple weeks, you might feel like you've gone back to baseline. Honestly, every time I've had a treatment, I've never felt like I've gone back to baseline. But if you do feel that way, it wouldn't be strange. And then usually around the 6 to 8 week mark is when you might be starting to pick up on something changing. That's usually when we're starting to or planning on having your second treatment. So usually those treatments are spaced about 6 to 8 weeks apart. The recommended dose, there is a generalized recommendation of the amount of vials you are decades old. So if you're in your 40s, 4 vials. If you're in your 50s, 5 vials. Not all at once. I never inject more than 2 vials per session. But even with that generalization of, the decades, I don't stick to that because it's not, it's a good guideline, but everyone's different.
Right.
I mean, it depends on so many things. The quality of the skin to begin with. Some people are just wanting a little prevention and they actually have pretty good quality of skin. Karlie's a great example. And just wants that extra boost.
Right.
So you might not need as much as somebody who maybe has had a ton of weight loss or, they just don't have this structure there. They might need more. So it is kind of a journey. We wait and see. Less is more. It's always my philosophy. I'd always much rather lean on that conservative approach and kind of see how that looks and potentially add more as opposed to just pumping a ton of it in there because that's what the company says that you should do. It's customized. But just know that if you feel like after 6 to 9 months, you're not quite where you want to be, that's okay. We're still continuing that journey. We'll add a little bit more and see if that's going to get you to your happy point. With Sculptra, since it's not a gel that sits there and can break down over time, most fillers last a year to 2 years. It just depends on lots of things. With Sculptra, since it is just your collagen, it's hard to put a real time frame on how long it lasts, but it's a pretty good recommendation to do what they call a birthday vial. So after you've completed your series, about once a year, it's a good reminder when your birthday comes around, you might consider doing another vial just to keep things looking nice. But again, that's as needed. Some people might have gone through a lot of weight loss when they had already completed their journey, so maybe they need a little more than just the one vial. Or maybe things look great and I might say, you know what? I think you look good. Let's hold off on that. Let's wait another year and see how things are. So it's not a hard, fast rule of dosage or, anything. It's just we kind of take it as it comes and see how you're responding to it. Some people are going to respond faster than others. So it can be a dosing issue. So I feel like I have so much trust in Sculptra. If you feel like you've gone through the series and you're not quite where you want to be, you might just need a little more, or we might benefit from a little filler at that point. It just probably is a little less filler than we would have needed before we prepared the skin using Sculptra.
And you can combine them if you
Yes,
need
yeah.
to, right?
Yeah,
Okay, cool.
they're not mutually exclusive. So just because we do Sculptra or just because we do filler does not mean that we can't do the other one. A lot of times they can work well to achieve a specific goal.
Did you mind just spending a moment kind of walking through sort of what you would, when you evaluate somebody, or what the who the perfect candidate is, and maybe Karlie can also say, what's the experience like at that first time?
So I feel like a lot of times people are a good candidate anywhere from potentially mid-30s if somebody is starting to want to be proactive. Or, I mean, we all age at different rates. So, somebody in their mid-30s definitely can be a good candidate, all the way up until, maybe mid-60s. That still can be a good candidate with the right person. So as long as people have reasonable expectations of this is not a magic wand and it's not instant gratification, that it's a slow process, and as long as you're here for the journey and you're okay just waiting it out, then you can be a great candidate for Sculptra. I can tell sometimes people are in my room and they are wanting instant gratification. I usually will not. I might talk about Sculptra, but I just so they know it's an option. But usually that person wants something right away. That's going to be a filler. So making sure that their expectations are in line with what my recommendation is. If somebody is acting like, or if they have a reunion coming up, in a month from now, Sculptra, you're not going to see that change yet. It's not a bad idea. It's just if you're wanting it for the specific event, a filler is going to give you more of that instant change. But somebody with thinner skin, if you already have really thick, good skin, then your collagen's working. So, I mean, at that point, I would probably be gravitating more towards a filler depending on that treatment goal, whatever the patient is looking for. But if they already have really thick, good skin, then, we probably need to look at something else. But I showed Karlie before her first treatment. I've been getting Sculptra myself for about 5 years. I'm not great about treating myself because I just don't have time, and I don't do it myself. I have one of the other injectors do it. So finding the time where we can carve that out is challenging. But as I explained earlier, I do get really thin in my temples and underneath my cheekbones. And so I showed her where I've had Sculptra, if I go and try to pull away that skin, it is pretty attached to the muscle and the fat there. It doesn't, the skin itself doesn't want to pull away. It's nice and tight. But where we haven't really focused on my jawline, I mean, you can really pull that skin out. So tonight we're going to be hitting that area. I know.
Yeah.
So I feel like it's such a good visual of, man, that is the Sculptra working. It's the skin is just nice and tight in that area. So somebody that is starting to notice those tiny little smile lines when they smile, or their crow's feet are creeping down in like into the cheek area, that is usually a volume loss issue more than it is a muscular issue. So again, it might be a little filler, but thickening that skin can really help to decrease those tiny little skinny lines when you smile.
Yeah, that's a good point. I would say my experience with Sculptra is, to anybody that wants to get it done, I think you should get it done. If Ashley and it says it's a good option for you, but don't Google it. Okay, don't watch it because it can be a little intimidating. I remember
looks aggressive.
It does. It looks aggressive. And I remember going in for my first treatment, and I think Jen was in there, and she goes, "Did she numb? Is she gonna numb?"
Oh, right.
You know, and it,
No.
but no, you don't. And so you think if you watch it, you think that they probably have, or you should, but you don't. Here's the thing: it doesn't hurt. It looks like it could, right? But it doesn't at all. It's kind of funny because we talk about uncomfortable pokes or like weird spots, especially by the temple, because it does kind of feel like, oh, you're getting close to, like pressure on your brain, maybe is what I like to say. And then there's like some pressure under your eyes when you're being treated, but no pain.
Right.
And even after, there's no pain at all, which is really nice too.
Yeah.
And I also think one thing to talk about with the process is the first time I went, and I think it was end of July, beginning of August, and then like September we did one, and I'll do one in October. But my first one, it was just kind of getting to know like what my skin was going to do and how it was going to react. So we used a needle the whole time, and I did have some bruising, which is very common. And then the second time, Ashley just nailed it. I'm telling you. I had like hardly any bruising. In fact, the next day, I think I sent you a picture. I'm like, there's no bruising. And so she just switched how she did. And you can kind of talk about that, but the process that she used, because it was just nice. I know that you saw what happened the first time, then we pivoted and like completely fixed it. Not that there was anything to fix, but it was nice just to not have like the bruising, around one eye that I had a little bit of, but very common. It lasts probably like a week and a half.
Yeah.
So the downtime is minimal. That's the other nice thing. You leave, and you're not going to have a ton of downtime, which is fabulous too. Obviously the time that it takes to kick in may take a while, but that glow happens after a week. At least it did for me, and I appreciated that. But yeah, the process that you used, like I guess you can kind of talk about that. Like we used a needle, and then you went to a different
cannula.
Yes, and that was just I don't know if you could tell a difference per se. Like I didn't feel a difference, but the aftermath of it was really nice. So
I do prepare everyone with
Yes, she does.
Sculptra
Yes, she does.
to expect bruising.
Yeah.
It's very common.
Yeah.
It's pretty likely. Of course, the goal is to never bruise anyone, but I am poking you a few times, and so bruising happens.
Yes.
There are certain things that you can do as a patient to try to minimize that. Again, I'm not promising no bruising, but avoiding NSAIDs like aspirin, ibuprofen, Aleve, even fish oil. Fish oil is one that gets a lot of people where they're surprised by that. Avoiding alcohol the day before, avoiding lots of caffeine the day of. All of those are things that you can do to kind of prepare yourself to hopefully decrease that chance of bruising.
Yeah.
Pre-medicating yourself by taking Arnica montana. It's a supplement that you can find at Whole Foods or Sprouts, and that could also help to minimize the chance of bruising. My goal is always to decrease or have no bruising, but I would much rather get you the result
Yes.
that I want to see,
Yeah.
knowing that bruising is a potential side effect of that, than potentially do a technique in a way where, okay, I might be less likely to bruise you, but you also might not be seeing the results that we want out of it.
Yeah.
So prepare for bruising. A lot of times for me, I get like a yellowish greenish bruise down by my jawline, which I notice. Nobody else really notices. It's easy to cover.
I have one right now, by the way. Hopefully, it's getting better. But yes.
I did want to touch on, though, some of the myths around Sculptra, which the most common thing that I feel like I hear from patients is they see videos on social media of sometimes plastic surgeons talking about how, I do not like Sculptra because it makes my facelifts so much more challenging. And they will say to me, now, I don't know if I want to do this because I've heard if I do Sculptra, it means I can't get a facelift in the future. So I know I have specifically asked you on multiple occasions over the 5 years or 6 years that I've been injecting Sculptra, like, okay, I just, we've been doing this for a while now, and I've never heard any feedback from any of the surgeons of having issues. And so I would love to hear just your personal experience of how you feel like Sculptra impacts facelifts.
Sure. And also I was going to tease you too, because Karlie probably heard this. Whenever get Botox right here, you guys like, it's going to be a little spicy.
Spicy, I know. I love that word, spicy.
Yeah, it's a little pinchy. No, good question. I've seen a little bit of that too, on particularly on social media and stuff. It's interesting how that's how you get some of your medical information out and stuff. But so that has not been my experience. I know that there are some plastic surgeons that have talked about or probably any injectable affecting how the facelift goes. In other words, so with a facelift procedure, we're making incisions that are, kind of going to be generally around the hairline, sometimes up in the hairline. It's usually going to follow the contour of the front of the ear, and then depending upon sort of the level you're doing, sometimes we'll bring it back behind the ear and down the hairline. Sometimes even an incision here as well to approach the neck, which is again why for guys, especially like me, you're losing your hair. It's a hard one to hide. So Sculptra can be a good addition. But so in the procedure, what you're doing with facelifting is that you have to then sort of elevate the skin off of the deeper tissues, which Sculptra is trying to augment. So, but in the process of doing that, if it's what we call sort of virgin tissue, like nothing's ever been done there before, then it tends to elevate very nicely. You can sort of find what we call the plane. It just separates easily, and just take your time, use the instruments, and let the tissues kind of show you where to go. But, if someone's already had something done before, for example, a second facelift you're doing, or I've noticed more actually for, like someone's had a skin cancer removed and they've got a scar in one spot on the cheek. Well, you'll see that there because it's usually gone through all the skin layers, and you have to be a little more gentle there. But I have not really, truly with any of the injectables, even the fillers, certainly not Botox, because that's generally kind of upper face, but I've not encountered like a lot of scar tissue. And I think that, maybe some of the other products that could be out there, some of those that are more of that almost calcium-based products that are supposed to go really deep, those you could maybe encounter a little bit more unusual texture to the tissues as you're doing the procedure. But with Sculptra, because we've described already, it's basically a powder, that you're kind of leaving behind and then allowing the body to make its own filler in a sense. It's just take your time. So it's absolutely in my hands. It's not a deterrent in any way. Matter of fact, I kind of like it because the skin's better,
right?
Thicker.
Yeah.
You've already kind of seen where you sort of rebuilt some of the soft tissues, so that when we reposition those with stitches on the inside and then sort of tighten the skin, you hopefully will get a better, smoother result than you could have without the Sculptra having been on board.
Yeah. We'd probably wait probably a year of, if somebody knows that they're going to be having a facelift, of not doing Sculptra within that year. But as long as the Sculptra is placed in the appropriate depth, of avoiding the muscle, I think that's where these plastic surgeons are coming into difficulties. Is the Sculptra was placed at the wrong depth. It was placed in the SMAS, which is the muscle layer, and that's not where you want it to be. So that's just really inappropriate placement of the Sculptra. If it's placed right, it should just complement and, improve the facelift as opposed to creating difficulties. So that's, I feel like the biggest struggle that I've had of having anybody with misconceptions about what Sculptra can and cannot do or what that means for the future.
Yeah. I couldn't agree more. And actually, that's one of the things I just love so much about Monarch. We've got now 7 surgeons. We've got a full injector team. We've got wellness. We have our estheticians, and not to mention, Jen Parker Quinn, our marketing director, and Nate, our producer, to setting all this stuff up. I mean, just got so many people on the team that if I see a patient that either you've sent or anyone, I can say, okay, can you tell me more about exactly this treatment? And we can just collaborate right there. Or, hey, this person, I did this facelift and I'm happy with this part of it, but I think they need more volume. So go over here and let's, I just love that part.
I think from a patient's perspective too, it's really nice because sometimes, obviously if you hip hop around from all different places, it's hard to get medical records from one place to another place to another. If you go to different, for example, hospitals, right? Then you have to make sure that their systems talk to one another. The best part about Monarch here is everything is under one roof, right? So if Dr. Leahy needs something and I've seen Ashley and I go to him for something, he can just call her really quick and they can talk through something. If Jess does a facial procedure or like a laser on me, you can talk to Jess about that. And so there's less, I think, work as a patient because you guys communicate so well, which is really, really nice too. So
well, we're honored that you can come and spend time with us today and talk about your experiences. I really appreciate that.
Absolutely.
Do you have any parting words you'd say, Ashley, about someone thinking that might heard this and maybe I'll go check it out? Anything else you would say?
I feel like one of my favorite slogans, which is not coined by me, but the best injectable is undetectable. And I feel like that's so much of what Sculptra is. It is just that, full face, but under the radar, just a natural looking improvement of how your skin looks. So nobody wants to most people don't want to walk into the room and immediately have everyone know like what they've had done. So if you're starting to think about anti-aging, not sure where to start, especially if you're in your 40s or 50s, especially if you are getting ready to start a GLP-1, it might be worth a conversation. Maybe you don't start right away, but at least we have talked about, what that might mean and start planning ahead. But with Sculptra, don't do it right before an event. Make sure that you've given yourself plenty of time to see those results so that you can really see that benefit.
Yeah. And I think I would say kind of my last little token, if you will, or whatever, is we meet a lot of people on the plastic surgery side that say, you know what, I've been doing these fillers, I've been doing these treatments and all this stuff, and I just want to get one big thing done. How about, and then I won't need the other things. It doesn't work that way. I mean, you're going to still want your Botox.
Right.
The fillers are really good. The skincare is essential.
It all works together.
Don't have an operation if you're not going to take care of your skin, So anyways, it's got to kind of refocus a little bit on that too. So
there you go.
Well, I guess we'll kind of wrap things up today, guys. Thank you so much for joining today. Karlie, especially thank you for coming out on a rainy day today.
Thank you.
And anyway, keep tuning in and checking out the Aesthetic Angle podcast. We hope to bring some really cool topics, kind of on an every couple week basis or something like that. So enjoy your day. Thank you very much.
Thank you.